Welcome back to Healthwise. Once again with us is Dr. Holly Provost, an OBGYN who uses our new technology at Opelousas General Healthcare System, the Da Vinci robot, nicknamed Leonardo, spelled D-E-A-U-X. Okay. Doc, tell us a little bit more about, you were saying that everyone has to go through this training class. How long is the class? How long?
It's just for a day. It's for 8 hours. And some people are saying that seems like not enough. I mean, you're using this big equipment, but really it's the same procedure we do abdominally. It's just done with smaller instruments. It is, with laparoscopic hysterectomies, it is harder to learn that because it is a 2D image. It is straight sticks. It is more difficult to get the learning curve on that. But when you put in the robot, it really is like you do an abdominal hysterectomy, just using smaller instruments. You could take it down the same way that you do everything else, and so training isn't as long. When you do laparoscopic hysterectomies, you have to take a couple of courses, or you learn it in residency, so you already know when you get out to private practice. It's just a more difficult procedure. But this is, you have to go see a competent surgeon do a hysterectomy. Like I went to see Dr. Fort, who's a GYN oncologist in Baton Rouge. But there's all over that Intuitive takes the physicians to, and then you have to take this little online course, which just tells you how to use the module, the station, and then you go do your lab and you go check everything out and use it and practice. And then they proctor people for 3 cases. So I've done my 3, and surgeons come over from all over who's experts in the robot to come and assist me and tell me the nuances on how to use the machine. I know how to do the procedure, but just to learn how to use the machine is what's needed.
They know a little bit. I get they got their little perks or whatever.
Oh, they know so much more. It's pretty amazing what they can do with it.
And I guess the more you do it, the more you use it, the better you're going to get with it. And then you're going to be the one that everybody's going to be, you're going to have to go proctor.
Yeah, I don't know about that, but Dr. Bork, who used to be here, Dr. Danny Bork, used to be in town. He came and helped me with one.
Really? Okay.
Yes, he's been doing it for a few years now.
Wow. Yeah. So this is not, it's new technology for us, but it's not so new, you know.
No.
I mean,
No, it's the same procedure, just using smaller instruments and using it with a laparoscope rather than a big incision.
Okay. And Doc, we didn't really get into, where's your office located?
I'm at the old Doctor's Hospital at South Campus. I'm up at the top floor. If you're looking at the building on the top left, I'm at Suite 205A.
Okay. Oh, you're the reason why. Every time I go to Doctor's Hospital, there's this line of pregnant women coming through the door, or they either, they're pregnant or they have children, and they're going, and I heard them say, and it just really didn't click. I heard them say, well, we're going to Dr. Provost. They always ask me where's the office, and I was like, upstairs on the 2nd floor. So now I get to meet the person.
Mondays.
Oh yeah,
on Mondays,
it's a line.
It's an OB day.
It's a line on Mondays of ladies coming up, going up to your office. Also, I know they were talking about Dr. Valley, I think, was going to be using it to do
the prostatectomies. Yeah.
Okay.
He's done a few already in Lafayette at Lourdes. He's done a handful, and he's looking forward to doing more. We've been talking about it, and he's already done his training a long time ago. So yeah, the hospital's excited for him to do his first case. I don't know if he has it set yet, but yeah, we can't wait for him to get and do his.
So it'll be that's I guess it's they showed a picture of it earlier and showed how simple,
That's a little bit more complicated because they're not used to doing it laparoscopically. They're used to going from the approach from below. And so his learning curve is a little bit harder because it's a different anatomy. It's a different way to get to things. So his procedure takes longer overall, and the learning curve is a little bit longer too because it's not what he's used to looking at.
Okay.
But we're excited for him to, instead of having to bring his patients to Lafayette, he can do it all here.
Now, do you think that the robot, and I know we're kind of keying on it, but other surgeons in other branches, you think they're going to be able to use? I guess what I'm asking is laparoscopic surgery the future for every, most
Not every specialty. Some places they do a thyroidectomy with it. I've heard some places do cardiac surgery with it. You could use it for anything abdominally, really, but it's kind of a wondering if it's needed kind of thing. General surgery, not so much. Maybe hernias. I have patients, I have one lady I was speaking to today who needs a hysterectomy but also has a hernia, an inguinal hernia. And so, well, she thinks she has one. So if I do the hysterectomy, I can look and I can see. And if I see a hernia defect, then I'll call a surgeon in and we could fix it with the robot as well.
Wow, that's a
So it saves
that's
her
a plus, right?
It saves her procedure. It saves her a different sleep.
Right, and then you, like you said, you can look. You're there and
I
you're
can
doing it and
see.
say, hey, okay, I don't have to.
I can see.
We're running out of time. I see we got a little bit of time left. Anything you want to say as far as telling people, you say you're located at doctors, what hours are you, do you take patients, or do you take new patients?
Yeah, I take new patients. We're open almost every day, 8:30 to 5, with lunch at between 12 and 1:30. On Fridays, we close at noon. But I use this with not just hysterectomies, I use this with patients with pelvic pain, endometriosis, ovarian removal, if somebody's already had a hysterectomy, if we need to go back in, and my hysterectomies.
Okay, so it's multi-purpose. It's not just hysterectomies.
No.
It's multi-purpose for you.
Yes.
Well, Doc, like I said, it was great having you on the show. Real informative about the robot. Because, like I said, I didn't realize, I'd heard about it,
Yeah.
but to actually get hands-on and to see what you do and to see the videos you brought were wonderful. That the people, the audience can see exactly how it works and not worried about, oh, she's using a robot and it's not the same,
Yeah.
but it's actually better,
It is, and there's plenty of videos on YouTube. So you can watch hysterectomies, you can watch prostatectomies, you can watch ovarian removal, you can watch endometriosis cases on YouTube.
What do they go to on YouTube?
If you just put in Da Vinci surgery, and usually a list will come up, or if you do robotic hysterectomy, a list will come up, and then you can watch legitimate hysterectomies or legitimate laparoscopic Da Vinci uses.
Wow. Okay. Well, Doc, once again, thanks for coming, and you're welcome anytime. Glad to have you on Healthwise, and audience, we'll see you next week on Healthwise.